Cardiovascular disease risk factors can be categorized into two types: positive risk factors and negative risk factors or protective factors. Positive risk factors include increase the likelihood of developing cardiovascular disease, while negative risk factors reduce the risk. Here are some identifiable positive risk factors for cardiovascular disease: high blood pressure or hypertension, having consistently elevated blood pressure levels, systolic pressure of 130 milligrams or higher millimeters, and or diastolic pressure of 80 or higher increases the risk of cardiovascular disease. High blood cholesterol, elevated levels of total cholesterol, LDL, the low density lipoprotein cholesterol, and triglycerides, as well as decreased levels of HDL or high density lipoprotein cholesterol, are associated with an increased risk of CVD or cardiovascular disease. Smoking, so tobacco use, including smoking cigarettes or exposure to secondhand smoke, is a significant risk factor for cardiovascular disease. It could also include vaping. Smoking damages blood vessels, reducing oxygen supply, and increases the risks of blood clots and heart disease. Diabetes mellitus, both type 1 and type 2, are considered positive risk factors for CVD. Individuals with diabetes have a higher risk of developing heart disease due to factors such as insulin resistance and high blood sugar levels and associated metabolic abnormalities. Obesity and overweight. Excess body weight, particularly abdominal obesity, increased waist circumference, is linked to an increased risk of CVD. Obesity contributes to other risk factors such as hypertension, high cholesterol, and diabetes. And physical inactivity. Leading a sedentary lifestyle with little to no regular physical activity increases the risk of CVD. Lack of exercise negatively affects cardiovascular health, weight management, blood pressure, cholesterol levels, and insulin sensitivity. A family history of cardiovascular disease. Having a close family member, parent, sibling, or child who has been diagnosed with CVD before the age of 55 for men or 65 for women increases the individual's risk of developing the disease. Age and gender. Advancing age is a risk factor for CVD, with the risk significantly increasing after the age of 45 for men and 55 for women. Men generally have a higher risk of CVD than pre-menopausal women, although the risk evens out after menopause. Unhealthy diet. Diets high in saturated and trans fats, cholesterol, sodium, and added sugars, while low in fruits, vegetables, whole grains, and lean proteins contribute to the development of CVD. So identifying these positive risk factors is crucial in assessing an individual's overall cardiovascular health and developing appropriate strategies for prevention, early detection, and management of CVD. It is important for individuals with positive risk factors to work with healthcare professionals to mitigate these risks through lifestyle modifications, medication if necessary, and regular cardiovascular health monitoring. The negative risk factors, also known as positive risk factors, are characteristics or behaviors that reduce the risk of cardiovascular disease. Having these factors present can help promote cardiovascular health and lower the likelihood of developing CVD. Here are some negative risk factors for cardiovascular disease. Regular physical activity. Engaging in regular exercise and maintaining an active lifestyle is a powerful protective factor against CVD. Physical activity helps improve cardiovascular fitness, maintain healthy body weight, lower blood pressure, improve cholesterol levels, and enhance overall cardiovascular health. A healthy diet. Following a balanced and nutritious diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats is associated with a reduced risk of CVD. A heart-healthy diet helps control weight, blood pressure, cholesterol levels, and blood sugar, all of which contribute to cardiovascular health. Normal blood pressure. So having blood pressure within the normal range with systolic pressure below 120 millimeters and diastolic pressure below 80 is considered a protective factor against CVD. Maintaining healthy blood pressure reduces strain on the heart and blood levels. Healthy blood cholesterol levels, maintaining optimal levels of total cholesterol, LDL cholesterol, HDL, and triglycerides is associated with lower risk of CVD. Having low LDL cholesterol and high LDL cholesterol levels promotes cardiovascular health. Not smoking, avoiding tobacco use in any form, including smoking and exposure to secondhand smoke. It helps protect blood vessels and reduces the risk of blood clots and lowers the chances of developing heart disease. Having normal blood glucose levels and avoiding the development of diabetes is a protective factor against CVD. And maintaining healthy blood sugar levels reduces the risk of cardiovascular complications associated with diabetes. And moderate alcohol consumption, which is defined as 1 drink per day for women and up to 2 drinks per day for men, has been associated with a lower risk of CVD. It's important to note excessive alcohol consumption can have detrimental effects on cardiovascular health and overall well-being. And stress management. Effectively managing stress and maintaining good mental health can be protective against CVD. Chronic stress and negative emotional states can contribute to the development of cardiovascular risk factors such as high blood pressure and unhealthy coping behaviors. And genetic factors. Some individuals may have genetic factors that provide protection against CVD, such as certain gene variants that influence cholesterol metabolism or blood clotting. Genetic factors are not under individual control, but they can contribute to a lower risk of CVD. Having these negative risk factors present does not guarantee complete immunity from cardiovascular disease. However, they do contribute to a healthier cardiovascular profile and can significantly reduce the risk of developing CVD. Emphasizing and promoting these protective factors through lifestyle modifications can have a substantial impact on maintaining cardiovascular health and reducing the risk of cardiovascular disease. Discussed earlier, you really want to identify any medical conditions and diagnose diseases, including cardiovascular and pulmonary disease. It's crucial to the client consultation and health appraisal process. So the symptoms, during their initial personal training interview, ask specific questions related to cardiovascular and pulmonary symptoms and inquire about symptoms such as chest pain, shortness of breath, dizziness, palpitations, coughing, wheezing, or any other respiratory difficulties. At this time, it may be necessary to do some functional and exercise testing. Depending on the severity of the cardiovascular pulmonary disease, it may require more additional testing necessary. These tests, such as stress tests or pulmonary functional tests, can provide further insight into the client's exercise capacity and help you determine appropriate exercise intensity and modifications. Pulmonary diseases can significantly impact the ability to transport oxygen during exercise. The lungs play a vital role in oxygen uptake, and carbon dioxide removal and any impairment in lung function can affect the respiratory system's ability to efficiently deliver oxygen to the working muscles. So here are some common pulmonary diseases that can impact oxygen transport during exercise. COPD, or chronic obstructive pulmonary disease, encompasses conditions such as chronic bronchitis or emphysema, which causes airflow obstruction and difficulty in breathing. In COPD, the airways become narrowed, reduce the amount of air that can flow in and out of the lungs. That results in decreased oxygen intake and impaired oxygen transport during exercise. Asthma is a chronic inflammatory disease of the airways characterized by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. During an asthma attack or exercise-induced asthma, the airways become constricted, limiting airflow and causing difficulties in oxygen transport. Pulmonary fibrosis is a condition where lung tissue becomes thickened and scarred, leading to reduced lung function. The scarring makes it harder for oxygen to pass through the lungs and enter the bloodstream, impairing oxygen transport during exercise. Pulmonary hypertension is a type of high blood pressure that affects the arteries and the lungs. It causes increased resistance to blood flow in the pulmonary arteries, leading to reduced oxygen uptake and delivery to the body's tissues, including the working muscles during exercise. Interstitial lung disease, or ILD, refers to a group of lung disorders characterized by inflammation and scarring of the lung tissue. These conditions affect the lung's ability to expand and contract properly, leading to impaired oxygen transport during exercise. Cystic fibrosis is a genetic disorder that primarily affects the respiratory and digestive systems. Thick, sticky mucus builds up in the airways, making it difficult to breathe and reducing oxygen transport during exercise. These pulmonary diseases can cause symptoms such as shortness of breath, reduced exercise tolerance, fatigue, and decreased oxygen saturation levels. It is essential for individuals with these conditions to work closely with healthcare professionals and exercise specialists, such as pulmonary rehabilitation specialists or personal trainers with expertise in pulmonary rehab, to develop exercise programs that are safe, appropriate, and consider the limitations imposed by the pulmonary disease. Exercise can play a crucial role in improving lung function, enhancing overall fitness, and managing symptoms for individuals with pulmonary diseases. Cardiac death, or SCD, refers to an unexplained death that occurs within an hour after the onset of cardiac symptoms in a person who may or may not have pre-existing heart disease. It is most commonly caused by a life-threatening arrhythmia called ventricular fibrillation, which disrupts the heart's normal electrical activity and prevents it from pumping blood effectively. The risk of SCD can be influenced by various factors, including cardiovascular conditions. So individuals with certain cardiovascular conditions such as coronary heart disease, artery disease, previous heart attack, heart failure, cardiomyopathy, or arrhythmias have an increased risk of SCD. These conditions can impair the heart's electrical system and increase the likelihood of arrhythmias. Family history. Having a family history of SCD or certain inherited cardiac conditions such as long QT syndrome, Brugada syndrome, or hypertrophic cardiomyopathy can elevate the risk of SCD. Previous cardiac events. So individuals who have experienced previous cardiac events such as heart attack or episodes of severe arrhythmias are at a higher risk of SCD. The risk of SCD tends to increase with age, with most cases occurring in individuals over the age of 40. Men are generally at a higher risk of SCD compared to women. And lifestyle factors. Certain lifestyle factors can contribute to an increased risk of SCD. These include smoking, excessive alcohol consumption, illicit drug use, and sedentary lifestyle. Use of certain medications, such as some antiarrhythmic drugs or medications that prolong the QT interval, may increase the risk of arrhythmias and SCD. It is important to consult with a healthcare professional regarding the potential risks and benefits of any prescribed medications. Structural heart abnormalities, such as congenital heart defects, valve disorders, or abnormalities of the heart's electrical pathways, can increase the risk of arrhythmias and SCD. It is important to note that while these factors can contribute to an increased risk of SCD, they do not guarantee that an SCD will occur. Many individuals with these risk factors may never experience SCD, while others without known risk factors may still be at risk. Identifying and managing these risk factors through lifestyle modifications and appropriate medical interventions and regular medical monitoring can help reduce the risk of SCD. If you have concerns, then it's advisable to consult with a healthcare professional who can assess the client's individual risk factors and provide guidance and care. Metabolic diseases, also known as metabolic disorders, refer to a group of medical conditions that affect the body's normal metabolism, leading to disruptions in the way the body processes and utilizes nutrients. These disorders can affect various aspects of metabolism, including the breakdown and utilization of carbohydrates, fats, proteins, and other substances. Diabetes mellitus is a chronic metabolic disorder characterized by elevated blood glucose levels. It occurs when the body either does not produce enough insulin, which is type 1 diabetes, or doesn't effectively use insulin, type 2 diabetes. Diabetes can lead to various complications if not properly managed, including cardiovascular disease, kidney disease, and nerve damage. Obesity is a complex metabolic disorder characterized by excess body fat accumulation. It's often associated with an imbalance between caloric intake and exposure and expenditure. Obesity increases the risk of several health conditions, including cardiovascular disease, type 2 diabetes, certain cancers, and musculoskeletal disorders. Metabolic syndrome refers to a cluster of conditions that occur together, including abdominal obesity, elevated blood pressure, high blood sugar levels, abnormal cholesterol levels, and increased risk of blood clotting. Metabolic syndrome significantly increases the risk of cardiovascular disease, type 2 diabetes, and stroke. Hyperlipidemia refers to high levels of lipids, such as cholesterol and triglycerides in the blood. It can be caused by genetic factors, lifestyle choices, and certain medical conditions. Elevated lipid levels are associated with an increased risk of cardiovascular disease. And metabolic acidosis, when there is an excess accumulation of acid in the body, disrupting the acid-base balance. It can be caused by conditions such as kidney disease, uncontrolled diabetes, or certain medications. Metabolic acidosis can lead to symptoms like fatigue, rapid breathing, and confusion. There are also inherited metabolic disorders that are caused by genetic mutations affecting specific enzymes and metabolic pathways, such as PKU or phenylketonuria, galactosemia, glycogen storage diseases, and mitochondrial disorders. These disorders can affect various aspects of metabolism and may result in a wide range of symptoms and complications. It is important to note that metabolic orthopedic conditions and diseases refer to a wide range of disorders that affect the musculoskeletal system, including bones, joints, muscles, ligaments, tendons, and nerves. These conditions can be congenital, where they're present at birth, or acquired, developed later in life, and can result from various factors, such as injury, overuse, aging, and underlying medical conditions. Orthopedic conditions and diseases often require comprehensive management and treatment, including lifestyle modifications, such as dietary changes and physical activity, medications, and close monitoring by healthcare professionals. The treatment approach for metabolic diseases varies depending on the specific order and the individual's unique needs. Musculoskeletal concerns related to acute trauma, overuse, osteoarthritis, and low back pain present issues and challenges that may need to be assessed. Lifestyle evaluation is an essential component of assessing an individual's overall health and well-being. It involves examining aspects of their lifestyle to identify habits, behaviors, and choices that may impact their health and quality of life. Physical activity. So assessing their level of physical activity is important to understand engagement in an exercise or regular form of movement. It includes evaluating frequency, duration, and intensity of their activities, such as aerobic exercises, strength training, flexibility exercises, or sports participation. Their nutrition and diet. Evaluating their eating habits and nutritional choices provides insights into their dietary patterns, food preferences, portion sizes, and overall diet quality. It helps identify any imbalances, deficiencies, or excessive intake of certain nutrients, as well as the presence of unhealthy eating behaviors or dietary restrictions. Their sleep patterns. Sleep plays an overall vital role in our health and well-being. Assessing an individual's sleep patterns involves examining their sleep duration, quality, regularity, and any difficulties or disruptions they may experience. Poor sleep habits or sleep disorders can have significant implications for physical and mental health. Stress management. Evaluating how they manage stress is crucial, as chronic stress can impact health negatively. It involves assessing their coping mechanisms, relaxation techniques, and the presence of any chronic stressors in their lives. Effective stress management strategies can contribute to overall better health. Substance use or abuse and examining their use of substances such as tobacco, alcohol, or recreational drugs is important in understanding potential risks to their health. It includes assessing the frequency, quantity, and duration of substance use and identifying any patterns of addictions or dependency. And mental and emotional well-being. Evaluating mental and emotional well-being involves assessing their psychological health, emotional stability, and overall mood. It includes identifying any symptoms of anxiety, depression, or other mental health conditions, such as evaluating their social support system and the presence of any life stressors. Considering environmental factors that may influence their health is also essential. So evaluating their living and working conditions, exposures to toxins and pollutants, access to healthy resources, and their level of engagement in environmental sustainability practices. So gathering information about their health history, their lifestyle evaluation aims to identify areas of strengths or areas for improvement in their lifestyle choices. It helps to guide their development of personalized recommendations, interventions, and strategies to support healthier habits and improve overall well-being, and just gives you an overall well-being picture of where they stand. Consulting with healthcare professionals such as physicians and registered dietitians or health coaches can provide valuable guidance and expertise in conducting a thorough lifestyle evaluation and developing appropriate interventions. The interpretation of results from the PARQ Plus can help identify individuals who may be at increased risk for potential health issues or complications. It is a widely used screening tool designed to assess an individual's readiness for participating in exercise or physical activity. So you want to review the completed questionnaire, identify their positive risk factors, as well as their negative risk factors, and looking at consulting guidelines and recommendations. How can you put the whole picture together? You may have to consider referral or further evaluation depending upon the results of that, and provide recommendations based upon the risks identified. It is important to note that the PARQ Plus is a screening tool. It is not diagnostic, and the results should be taken into consideration with other findings as well. The American College of Sports Medicine provides a pre-participation screening algorithm to help determine the need for medical clearance before engaging in exercise or physical activity. That algorithm takes into account their health history and current medical conditions. And it helps in determining the individual's desired exercise intensity, and by looking at their health status and their age profile, as well as looking at the presence of their known cardiovascular, metabolic, or renal disease, where they stand with that. So with all of that, you evaluate the presence of any signs or symptoms, and then determine what their exercise intensity and presence of any cardiovascular risk factors might be. So with all of that, you're able to provide recommendations for safe exercise for your client. And so really important that you are going through and determining who can participate in regular exercise and who probably should not participate in exercise or who needs further guidance. We talked about the referral process and medical examination play crucial roles in ensuring the safety and appropriateness of individuals participating in exercise or physical activity. So with that, again, making sure that you're covering their positive risk factors, who's at a high risk status, any abnormal findings that you might have, and possibly having them do EKG or referring them to a doctor so that they can do EKGs and stress testing. Looking at your special populations, your older adults, pregnant women, or individuals with chronic diseases or other disabilities may require specialized care and supervision. So a referral to appropriate healthcare professionals with expertise in managing that population is essential. Physicians play a crucial role in providing program recommendations after conducting a diagnostic medical examination and relevant testing based on the individual's health status, their medical history, the results, and specific health goals. Physicians can provide tailored recommendations for exercise and physical activity. Physicians may provide program recommendations after diagnostic medical testing, and they may give recommendations for an unsupervised exercise program, a supervised exercise program, or even a medically supervised exercise program. So with that, the physicians can provide an exercise prescription. I'll be honest, most physicians aren't necessarily schooled in this very well, which is really sad. But they can provide types of exercise and physical activities that are suitable for the individual's health condition and goals. They may include aerobic exercises such as walking, cycling, or swimming for cardiovascular health, strength training exercises for muscle development, flexibility exercises for improved range of motion, and balance exercises for stability. Physicians can also advise on appropriate intensity and duration of exercise sessions based on the individual's fitness level, health condition, and overall goals. This may involve prescribing specific target heart rate zones, perceived exertion levels, or time-based recommendations. They will also recommend the optimal frequency of exercise sessions per week based on the individual's health status and goals. It may range from several times per week to daily, depending on the individual's condition and ability to recover. Physicians can also provide guidance on how to progressively increase the intensity, duration, or complexity of exercises over time. They can provide specific guidelines on when and how to progress to ensure a safe and effective training program. Physicians can provide specific modifications or precautions to consider based on the individual's health condition or any existing injuries. That may involve recommending alternative exercises, advising on weight limits or local load adjustments, or suggesting modifications to accommodate any physical limitations. Physicians may also recommend regular follow-up visits to monitor progress and assess any changes in their health status and make any necessary adjustments to the exercise program. This helps ensure that the program remains safe and effective as the individual's health and fitness levels evolve. In some cases, individuals may require medical treatment alongside their exercise program. Physicians can provide guidance on the integration of medication management, rehabilitation exercises, or therapeutic interventions into the overall program. And if necessary, physicians can refer individuals to specialized healthcare professionals such as physical therapists or exercise physiologists or registered dietitians to further support the individual's exercise program and overall health goals. And it is important to consult with physicians and follow their recommendations closely, especially when dealing with specific medical conditions or complex health issues. Physicians have the expertise to assess an individual's health status comprehensively and provide appropriate program recommendations that prioritize safety and overall well-being. And this is the ACSM pre-participation screening algorithm. I highly recommend that you get to know it very carefully. And so understand that when it's appropriate to exercise, when it is not, when they need medical clearance, when they don't need medical clearance, and to go from there. So there are questions on the test based upon this material. Make sure that you know this. And that is all I have for today. I look forward to talking with you again. Y'all have a great day.